It's Anonymous MD with Dr. T.
And Lisa.
Dr. T brings the real and refreshing insights, straightforward, evidence-based, and up-to-date. Now here's the doctor and Lisa.
All right, here we go. Episode 5, Lise. You excited?
Unbelievable. Very excited that we are now one whole hand. It's great. It's a big moment.
I think when we started doing this, we were only planning a 4-episode mini-series, but we're lucky because now we have some experts and specialists who are kind of excited about coming and helping us share some of the knowledge that we feel can really help people get through this COVID era.
I think our listeners are going to be really excited about the fact that we have some new voices coming in and some new knowledge coming in. So that's great.
And today is a dandy. Let's start by going over some updated numbers. Okay. So it's April 16th. We're officially over the 2 million mark in terms of diagnosed coronavirus cases. That's probably not accurate. There's probably a lot more than that, but we're going to get into that in a future episode. We need to hammer down the case fatality rate and the concepts behind that. So we'll do that. But today we're going to focus on mental health. The deaths around the world are now logged at 145,000 or just above that. Today we're going to have a guest, and this is the first of many, many interviews to come. And it's about mental health during the COVID-19 era.
Oh, you know what? I think that I'm really excited. This has got to be one of the most important topics we could discuss right now. And so I'm so excited that it's our first one. It was a great idea that you had. I'm going to give you credit where credit's due here, Dr. T. A good one. I know so many people personally who need mental health support right now. We all do on a certain level, but I know a lot of people who need it in a more intense level right now. And I'm committed to doing my best to support them. But I could personally really use some expert advice on doing a good job of doing that. So I'm looking forward to this so much.
And that's part of the support, right? Is by broadcasting some rational, calm, collected messages that people can take and put to practice. And hopefully we can affect a lot of people in a positive way. Study after study in the scientific literature shows that the largest loss of productivity and cost of disability is for mental health disorders. And that exceeds any other mental health condition and any other mental condition that we know of in terms of loss of productivity and disability. Wow. So without further ado, I want to introduce our guest. His name is Dr. Kodsi. He's a psychiatrist and the former chief of child and family psychiatry at Humber River Regional Hospital. He's also an assistant professor at the University of Toronto. He's a 35-year native of Toronto and the co-founder and medical counsel for a wonderful charity called Caring for Young Minds. Please go to their website and help their cause. Their website is caringforyoungminds.ca. And their motto, I love this motto. It's at the top of their website. It says, creating a world without barriers for children. And I think they're the lost piece of the population we probably don't talk enough about. So without any further ado, thank you for joining us, Dr. Kodsi. It's truly an honor to have you here as our first guest on the podcast.
Thank you, Dr. T, and thank you, Lisa, for inviting me to have some discussion with you.
Thank you for taking us up on the offer. We're very excited to have you.
Very exciting. So let's jump into the meat of the matter because we have a lot to cover, but it's a lot of very helpful, useful, deep information. So let me start by asking you a question. How do you feel about that, Dr. Kodsi?
Well, I agree with you that mental health is really an area of our life that many people don't understand and many people don't actually seek help with. But now the whole world is living a crisis, and we need to look at this population and see what we can do for them.
Yeah, and I think one word that pops out there is this word crisis. And, if we were to specify the crisis that we're currently in the midst of, it would be this COVID-19 pandemic. And obviously, social isolation campaigns are around the world, not in every country, but I would say in the majority of countries, and it's affecting all of us psychology. But one of the main questions I had for you are, who are the most vulnerable during this campaign of social distancing and quarantine? Who should we be paying the most attention to from a mental health perspective during these difficult times?
Oh, you know what? Of course, that's your question, though, Dr. T. Doctors love triage, after all, but
we love triage.
Fair enough. I mean, we have limited resources in the healthcare system, so we need to treat those who need it most first.
That's a definition of triage is for physicians to identify the most acute or dangerous medical situations affecting a patient and prioritizing their resources accordingly. So that's just, we digress a little there, but how do we triage our people who are in social isolation? Who's the most vulnerable?
Yeah, there is no doubt that this is, as you mentioned, it is a crisis, a worldwide crisis, but also the insidious nature of this crisis is making it even more complicated and more difficult to deal with. And just to think of just few populations, specific populations that they are in the top of the list. I could think of children and adolescents, young people. Now, all of a sudden, you're asking them to be housebound all the time. This is heavy duty for most, let alone for young people. But I also think of the older population. When their life is usually compromised in some area or another, whether it's health or age or disability or even financial concerns. The third population I have in mind is the population of the people who are diagnosed with serious mental disorders. So already they are struggling to cope with life as it is, and now we have such crises to deal with all struggles and challenges that comes with it. And also there is a new population developed with the crisis, and it is the population of people that they experience major and significant losses already, or really people who are anticipating a very serious and significant loss in any part of their life, whether the loss of a loved one or the loss of a dream or a loss of a business and so on. So these are the four populations that on top of my mind that I could identify at this point.
Wow, that's really helpful. And I think what I'm wondering is there something different that we should be worried about with each of those four populations? So immediately your first one was children and young people, which is a population close to my heart. What is it that we should be worried about or looking for in that group?
Let us address the children and young people, as you mentioned, that they are on top of the list, because this population or these kids and young people, the lockdown is exactly against what they need and what life is all about for them. Talk about kids trying to discover the world, and everything is an exciting experience. Talk about teenagers when this is the time they are forming their their identity and their views of the world, and they move from one context to the other with so much excitement and celebration. And all of a sudden, you're asking these kids to be stuck in a two-bedroom apartment or a basement apartment or even a big house. This is absolutely against their developmental needs and their normal life. So it is a challenge for them to actually cope. And I should, yeah, and then we will see what we can
well,
do.
Why don't you tell us more about the other three categories that you emphasize? So you spoke about the elderly, you spoke about the people who already have been diagnosed with a serious mental health disorder. And notice we've used the word disorder because we really need to emphasize that this is a disease process, no different than something like diabetes or hypertension, in the sense that it is out of our control. It's not as simple to say mind over matter. And then the last group you mentioned were those new cohort that are experiencing this significant loss. And more specifically, I'm hearing a lot of anecdotal stories about families who lose their loved ones and aren't able to be by their side because of infectious disease precautions, and also their celebrations of life are also affected. So, between the elderly and those suffering from mental health and those experiencing significant loss, what do we think about those populations?
Yeah, let me look at one population at a time. So the seniors, as you know, they are the population that their life is, and the details of their life is rather reduced to a very routine and very specific pattern in going on with the life. You talk about fixed income. You're talking about certain health conditions. You're talking about potential for relative social isolation. You're talking about, so their life, they are coping. And now you're faced with a situation that coping is not enough, because there is the checklist that you keep dealing with. Being an elder, being a patient with chronic medical condition, hearing about your retirement funds is not really a fun thing at this point at all. Talking about not seeing people or not even going to the bank and deal with the bank teller as the activity of the day. So these people, all of a sudden, a lot of their support around them and a lot of consistent and predictable issues in their life, all of a sudden, very, as you pointed in one of your podcasts, the age of uncertainty, and all of us are struggling with that. So they are more vulnerable, because the checklist that with the crisis, there are a lot of parts of their lives that is unknown, uncertain, and probably they are at the top of the target list for the coronavirus. Now, let's move to the people with serious mental health disorders. These people are, again, coping with their life with the support of their therapist, with the weekly group they attend, with certain support from their families and their communities. And now you're taking away a lot of their support. Even their regular therapy visits with their professional teams is done over the phone. Let me elaborate on one particular serious mental illness, that the fact that there is a lockdown, the fact that there is an unknown virus challenging the whole world. It may feed into their certain degree of um, suspicion, suspiciousness, and certain degree of feeling mistrusting the world. So all of a sudden, you're feeding into their symptoms and their daily struggles with a huge crisis of uncertainty. And if you hear politicians, they are mistrusting each other and they're bickering and they are accusing each other. So the population of serious mental illness is another population. They are at risk. Now, let's move to the significant loss. Death and grief are challenging for all of us. It is a concept, the concept of death is actually a challenge for many people. Now you're adding another layer to the experience of loss. It could be, as I mentioned, a loss of a dream. Just talk about a small business just started with people just remortgaged their house to fund the family business, and all of a sudden they have shut down. You're talking about people losing their loved ones without having the opportunity to be in their bedside. And so I would expect that a good deal of people losing significant and important people and parts of their life will lead to quite a bit of complicated grief, which is really not the normal grief to unfold, but rather to linger for a while and to be a little bit more deeper and more difficult to deal with. I hope I didn't go too long.
Dr. Kodsi, that was wonderful.
So much.
We're going to summarize. We'll summarize at the end, I think, Lisa, so that our readers can take the main points home. And I think that's probably something that we should do.
There's so many things that you said that just are mind blowing. Like if I'm thinking about, I hadn't thought about people with paranoia and how sort of the fact that their paranoia is being confirmed by what's going on and by this global pandemic. That's really, that's really got to be something difficult.
Yeah, sorry. And even, Lisa, the complication of anxious people. Anxiety is, the prevalence of anxiety in our society is very high to start with. And now we're talking about another challenge that with the uncertainty of our world as we used to know it.
Well, and I know I've personally downloaded a meditation app because I needed it to get through a day one day. So I can sympathize with people when it comes to that.
I'll just add one more example because we didn't talk about our patients with depression. One of the number one signs of depression is something that we call anhedonia. And anhedonia is a term that we use for this deep and severe lack of motivation to be able to get out of bed and start their day. So if we're removing that option to get up and go to work or go to see family members or ride the train into the city, well, that can definitely make the depression last longer. Now, again, a lot of what we're saying is not evidence-based because COVID-19 is a new entity that's unprecedented. It's something that we see every century. And it's definitely not something we've seen to this scale during modern medicine. But common sense tells us that people with mental health conditions are definitely one of our more vulnerable populations.
Let me add to that because this is a very good point. We know that scientifically that human beings are able to cope with a severe crisis for a short period of time, regardless of the magnitude and the severity of the crisis. But we are not very good in dealing with even moderate crises for much longer time. And that's why every time I hear people talking about life will go back to normal probably in 2021, it concerns me and the mental health of our population and community. I hope it is, as economists say, it is a V or a U, but we can't handle a lot of W's for the next year and a half.
Or even an L. You never know. You might get an L.
L, you're talking about a lot more detrimental.
For our listeners who are unfamiliar with V versus U versus L-shaped recoveries versus W-shaped recoveries.
Who is unfamiliar also. Yes, please.
We will, I think we'll maybe spend an upcoming podcast discussing those, if you'll so allow me to get a little bit more economical in terms of the content. But let's stick to mental health here, because I think we've done a great job of identifying our most vulnerable populations, although all of us are being affected by this. And I think we've also done a good job about the specifics concerns we have regarding those groups of people. So the next logical question in my mind would be, what do we need to do to support them? How do we carry them through this COVID-19 era? One, which I think I agree with you, will be longer than most anticipate. In fact, we may just end up with a new normal. I mean, if I can just speculate for a moment, I anticipate that most likely young, healthy people will be sent back to the workforce wearing masks and taking precautions to protect themselves. And there's a lot of talk now that the elderly and the high-risk groups will continue to socially isolate until we have a vaccine. And the most hopeful measures are 18 months. So let's say best case scenario, we have a vaccine in 18 months, and now all of our population can now leave their homes, and we have a full campaign of de-isolation. What do we need to do in the meantime?
All right. So, as I mentioned before, children and adolescents, you're really giving them an experience exactly against what life is all about for them. So, still, this generation is much luckier than if this happened 20, 25 years ago, when we didn't have the internet and the virtual world, that kids can still, or young people can still associate with each other and have some sort of contact with each other. So I would be a little bit more generous with what I expect from young people to use screen time and online connection with people their age. And this is one thing I would do for the children and adolescents. Children in particular, that they need a lot of energy. So I would advise the household, whether the adults in the household, whether single parent or more than one parent or adult, to actually budget their energy to take care of the young people, because young people, they have endless energy, as you know, and a lot of curiosity and a lot of exploring to do. So I would say that adults, they need to sit down and say, how we're going to do that. Don't just deal with the children as things happen. Plan it. Kids need structure, need consistency, needs predictability. Like, they do very well when you tell them this is going to happen, and after this happens, something else is going to happen. Kids are visual learners. Use markers, use calendars. Just take care of the kids, that they see the world is a little bit more predictable and a little bit more clear, and some
Would
tolerance.
Structure be a good word to use there? Creating some kind of structure?
And routine and consistency, for sure. Teenagers, I think, with social distancing, they still could do a lot in terms of online. And any household, we need to be very patient and tolerant with each other. This is very frustrating, and sometimes when people feel helpless and don't know what to do, they become a little bit difficult. So we need to allow each other to go through our moments, as they say.
Right. We need to be compassionate and know that we're not all going to be at our best all the time, even more than
Absolutely.
usual.
Let's take turns. Let me put it this way. When we externalize or act on feelings of frustration and uncertainty or insecurity as well.
Lisa, I give you credit because you did bring that up in an episode, but probably a couple of episodes when we were talking about uncertainty, episode 3. You mentioned this whole idea of being compassionate, not just towards others, but also to yourself.
Mm-hmm. Yes. I mean, it's a lot going on right now. And I find that, a lot of mental health issues begin with not having compassion for yourself and not understanding that you too are a human being, just like everyone else. And you can't expect perfection.
So let me add to this point. If you remember when we used to fly before they grounded all this flight, the instructions is to put your oxygen mask first before you take care of anybody else. To your point, Lisa.
Oh, that's such a great analogy. I love that.
Dr. Kodsi was always great with analogies, learning from him.
It just helps you to understand it and to
Absolutely.
visualize it. So
Absolutely.
Thank you.
I'm working on my analogy game. I've tried, and they'll continue to improve. But 35 years more experience, you can see his analogy game is quite strong. Dr. Kodsi, do you mind telling us a little bit more about the elderly, what we can do for them, and then jump into people with diagnosed mental health disorders and those dealing with a new form of grief?
Right. Well, with the elderly, obviously, you can take care of them in a number of ways, but I will just skim over a few ideas. Don't make a long phone call once a week to your elderly person. Call them every day for 3 minutes. And make sure that you try to put some digital pictures together and from the past and good times and all these wonderful memories, and send it to them or make it available to them somehow. Also, for elderly, make sure that, keep in mind, whoever is available, whether it is a neighbor or a delivery person, and passing a conversation literally for 30 seconds could make a difference for them, that actually people not only knocking at the door and leaving things 6 feet apart, but rather exchanging few words. So it is not really what is delivered or how much contact, but the frequency of contact and also the meaningful contact, that you add a touch of genuine care, how people are doing. Mirroring their new insecurities is very important. I would advise elderly people not to start checking their will and not looking at their funeral arrangements, because still the numbers are not going to hit most of the elderly. They say they are vulnerable, but I'm telling you, 9.9999% will be around in 2021 and they will die from other things. So let us not make that because you are a vulnerable age group that it is going to happen to you. Don't listen to statistics. Statistics don't say anything about one single individual. And all you care about is the life of one single individual. This is really...
I think that's great. I think that's great advice for the elderly, and not just for the elderly, but also for the people supporting them. And when we talk about people supporting them, we're talking about, like you said, the mailman or the grocery store clerk or the long lost nephew, or the nuclear family. So I have found in my time working with the elderly in my geriatric population that the real medicine is for them to feel present, and for them to feel part of the dialogue, and for them to feel cared for, and to feel like someone is listening to them.
Absolutely.
Right.
Absolutely.
People can't be touched right now, even though physical touch is so powerful, but they can feel seen and they can feel heard. And
You're right,
and
Lisa.
that's what matters.
And elderly people are very tactile.
Mhm.
They need the squeeze in their shake hands.
Yes,
In fact, they can see
I do
very
too.
far. By the way, it's
Yeah.
something called the name slips me, but the lens becomes less curvatured, and so they end up having a great ability to see far distances. I wonder if
Right.
this was some kind of an evolutionary mechanism,
Oh, I had no
and
idea.
which is
Very
why they
interesting.
often wear reading glasses.
Very interesting.
Okay, Dr. Kodsi, let's take, this podcast has gone so well, and I don't know if I'm off base by bringing this up mid podcast, but we may have to split this podcast into two editions, into two episodes, and release the second episode next week, because I think there's just so much that our listeners need to take in over the next week, so that we can set the stage for the material that we wanted to cover. If I think probably to wrap up this episode, part one, about mental health during the COVID-19 isolation era, we'd want to touch on the individuals who have already been diagnosed with this serious mental health disorder, and talk about those new elements of grief that people are dealing with.
Uh, so let me quickly look at people who are diagnosed, who are living with the diagnosis of serious mental disorder. These people, as I mentioned before, they are coping with their life with the support and help of a lot of people, including their mental health professionals for sure, but also on some significant uh, amount of medication that takes care of them. So we're talking about a population who are coping with their compromised life in many ways. Now we're asking them to be resilient, which means they do with less, and to recover the crisis and move forward. Uh, so these people, I think, we need to make sure that their basic needs are met in terms of medication, food, shelter, uh, and contact with their support, whether virtually or in person, with all the safety measures um, kept in mind.
Mhm.
And the last thing you want to tell these people when they actually express how much they are stressed out or struggling, please don't tell them, did you take your medication or not? Because they are doing a lot of personal efforts and emotional efforts to cope with life. So please don't reduce it to a pill. Acknowledge how much they are actually uh, making efforts and struggling to cope with this situation.
Do you think there's a role for frequent contact through telephone or video conferencing for our patients who are suffering from mental health disorders?
Yeah, I think OHIP has been working on e-contact with patients. Uh,
OHIP,
but
for any of the listeners not from Ontario, stands for the Ontario Health Insurance Plan, and it's
however, there is,
our
yeah, sorry, but there is a glitch between the government and the profession, I believe. The OMA was raising some concerns about lack of response. But my understanding on the ground, mental health professionals and psychiatrists are making themselves available by phone for many people and video conferencing if available.
And you think that this is a necessity at this point in time, or what's your view in terms of non-physical contact with our mental health patients?
I think it is necessary because keep in mind, many of serious mental disorders, the social life of the person is compromised, and sometimes the family life of the person is compromised. So there is a good deal of reliance on the professional help and professional support. And I believe that it is very necessary. People develop a human relationship. There is such thing as relationship therapy for many of these individuals. So I think it would be wise as a community and as a society not to deprive people from this source of support, particularly at this point of time in time.
So I just wanted to follow up the question once more so that the listeners understood. If you had an elderly patient who is classified as high risk for contracting COVID-19, would you feel that the benefit of an in-person consultation would outweigh the risk of severe disease from the coronavirus?
I can't be specific about the coronavirus itself, but I would say that we know that there is a strong connection between serious medical conditions, including cardiac diagnosis and cardiac problems, and depression, and the mental health of the individual. We know that people who sink into depression with serious heart attack, they remain in the intensive care longer than people who are in a better morale and better mental health.
Lise, what do you think?
Well, I mean, that's interesting. So what you're saying is that even if they do contract it, the fact that they've had mental health support will help them to recover better from pretty much any illness.
Right. Particularly if the relationship is already in place. Particularly if the elder is already in care of a mental health team or a mental health therapist. I think a phone call or some sort of contact could go a long way.
So already an established relationship with trust and
right.
Yeah, got
What's more important than the brain, right?
Yeah.
Right. Well, it's everything.
So you know, I again, this podcast episode 5, I think just went so well that I think we're going to have to have a part 2. Dr. Kodsi, would you be willing to do a part 2 so that we can give our listeners a little bit of some time to go over what we've covered today and continue where we left off next episode?
I'd be happy to do so.
Oh, good. I have lots of questions.
The only thing that would be left for us today is to discuss those experiencing a significant loss in a way that perhaps is quite unprecedented. And then from there, Lisa and I will take our best stab at summarizing some of the key points we went over today. And we look forward to seeing you again next week.
I'll be happy to.
That's great. So what do you think about the grief?
Well, as I said before, I think we're going to experience a lot of losses along the way. Human loss is the most detrimental, but also a lot of losses in terms of financial losses, certain sense of security will be lost. And I think we need to pay attention that loss is a normal human experience, but certain losses are more complicated than others. And we realized that somebody came with the idea that grief and loss should last anywhere from 6 weeks to 6 months, and I haven't seen such thing. You can't put a timeline like 6 weeks, 6 months on a very complicated and very significant human experience. So
and I think, I just to comment, I think that the data shows us that the more traumatic or unexpected or violent the loss is, the longer and more complicated the grief tends to be.
Right. Exactly. So we know that this crisis is going to put many people in a very complicated grief and loss situations. And I agree with you, we could elaborate in more details of how you identify a complicated grief, what is the best course of action if it happens, when it happens. But I could see that from what I read and what I can see around me, that the world is not the same anymore. Like in the beginning of the podcast, you talked about some countries, we don't know the exact numbers of COVID-19 cases and even the death toll. So it is unfolding situation, but who said that if I lose a family member or a loved one, that I'm not going to lose my job at the same time, and I'm not going to lose my savings along the way, and I'm going to lose my dream of moving on my career at the same time.
And I think what's happened to the stock market and the volatility is an expression of that a lot of retirement funds are depending on cashing out at the right time, and interest rates are quite low. So this is again playing a role when we talk about the elderly and grief, actually, and grieving. I think, what do you say, Lisa? Meatiest podcast we've had so far?
Absolutely. There's so much to think about right now. So I think it's really important that we, recap this. So let's look at what we talked about is that, it's a risky time, I think, is what Dr. Kodsi was saying right now, is that it's a risky time on almost every level of risk for a person, personally, professionally, financially, in a mental health way. And so what we need to look at in psychiatry is what are the vulnerable people that are most at risk right now? And Dr. Kodsi has given us these 4 groups that we need to pay the most attention to right now. And I hope everybody was listening. In case you weren't, here it is again. So we have our children and young people. And Dr. T, do we remember what we need to do for our children and young people?
I love when Lisa pop quizzes me. The tables have turned.
That is right. So the turns have tabled. Here we are.
Yes, the turns have tabled. Well, I think one of the main points with children is we're really asking them to act against their nature. Their nature is to be active and move around and discover. And so, one of the things we need to do is create some programs and some structure for them so that we can engage them in ways that they need to be engaged. And that includes using technology. We've alluded to the use of technology in the past, and getting them on the camera screen with their former and future classmates and relatives. Mm-hmm. And for the teens, it's really about developing their identity. So they tend to be a little bit more autonomous, but as adults and role models, we can help guide them in this new world.
Maybe let them paint their bedrooms black. That's something they
encourage
can do
them
while
to
they're in
do
isolation.
non-screen activities, perhaps.
That's right.
And then I think the overall theme that came up when we were talking about children and teens, and of course we have to include parents in there, is just patience and tolerance in the household. Everybody has different coping mechanisms, so we need to accommodate those and be warm. So
That's right,
how did
because
I
we're
do?
stuck
How
with
did
each
I do?
other pretty well. Not bad.
Yeah. What
Yeah, you
else?
were
What are
paying
the other
attention.
groups?
Group number 2 is the elderly.
The elderly. And the elderly are already a population that is, I don't want to say forgotten, but less engaged by the rest of society. So this isolation may affect them quite drastically. One big point I got was, let's not overreact and assume that because we're a high risk group that we're going to die, and accept the fact that the vast majority of us are going to be into 2021 and will probably pass from a different condition. So let's not drive that anxiety by checking our wills and arranging for our funerals. And for family members, it's much more useful to make them feel remembered by calling them frequently, and maybe the calls are shorter as opposed to less frequent calls that are shorter. And to digitize, let's help send them, let's get them on emails and buy them iPads and get them on the screen to see their grandchildren and their children, who I'm sure they live for. That's all they live for at this stage in their lives.
Well, they're reaping the rewards of all their hard work and that they've put in. And so they should continue to reap those rewards even during the COVID era, I think.
Absolutely. And the technological revolution, they made it to both.
That's right. Okay.
Right?
Category number 3. Are we ready for it? People
Let's
with
do
serious
it.
mental health disorders.
Yeah, so, I think one of the main points was that they are already toiling with emotional angst, and what they may see happening around them may increase the risk of suspicion. It may drive anxiety. It may exacerbate psychoses. It may make depressive episodes more frequent and deep. So we need to provide them services remotely for now, through the types of codes that our governments are providing for remote visits. But we really call into question after the COVID-19 if we should continue this way with our mental health population. In fact, it sounds like, from what Dr. Kodsi has said today, that part of it is having them develop a relationship with their practitioner, and to be in the same location. And we can continue to do so safely. And so we're going to have to be creative in those ways.
Right. And we have to also make sure that they have their basics covered and that they're safe, so that they understand
Absolutely.
what they need to do to keep themselves safe during the pandemic, but also that they are sheltered and fed and have their medications and with the basics of life. Okay, now we have our 4th category, which is people who have experienced or are experiencing a significant loss along the way, those who are grieving.
Those are very new and fresh questions, I think, was one of the main points. We still don't understand the number of cases. We don't understand the number of deaths, but it's definitely a new complicated layer of grief when we talk about the way that celebrations of life are being limited, as are the ability of family members to be close to each other. I don't think we alluded on this, but I think I'd like to end on this point. Is I think hospitals and institutions need to also, from the management and executive down to the frontline staff, should be a little bit more compassionate towards how important it is for loved ones to be near each other when someone is dying. There are shortages of PPE, and masks and gloves, and we need to keep people safe. But again, we should be developing electronic means by which families can be together when somebody is living out their last moments. That was something Dr. Kodsi, I don't think, did said. I snuck that one in there.
It's a good idea.
But how did we do overall, Dr. Kodsi, summarizing your main points? Anything you'd like to add before we wrap up?
Well, 10 out of 10.
10 out of 10, Lisa.
Let's end on that
Wow.
note before we
We'll
mess
end
that
on
up,
that
you
note.
know?
Yeah. I want to make one more emphasis, and I said this at the beginning of last episode, and Lisa made a great point in terms of the specifics. If you would like to go out with one of your household members on a walk outdoors or a drive outdoors with the windows down, and you don't stay still and you don't contact other people or contact surfaces and take the utmost precaution and wear a mask to protect others, if you need that for your mental health, you have our support here at Anonymous MD.
That's right.
Great.
Great. All right. Well, thank you so much, Dr. Kodsi. We can't wait to speak to you again next week. And for now, listeners, listen to us wherever you get your podcasts, and remember to follow, subscribe, and hit that bell, which is
And
just
thanks-
the YouTube way of saying subscribe. So that's fine.
Always a thanks to the pod plant for adapting to our new world and keeping the dream alive. We appreciate you so much. Till next time, folks.
Thanks for listening to the show. Subscribe wherever you're listening to the podcast. On YouTube, smash that bell. That's a notification button. Anytime the doctor knows something, so will you. Stay healthy. See you next time.